and welcome to Diabetes Deep Dives. My name is Candice and I am from Diabetes Canada. If you are new to our video series, thank you so much for joining us. If you have been enjoying the series, welcome back. Our Diabetes Deep Dives video series is designed to go beyond the surface of general diabetes education information. We hope to spark continued interest and learning and leave you with practical tips and tools that you can easily use. Subscribe to our YouTube channel and click on the notification bell to be notified about new content. You can also check us out on social media to find out when the next one will be posted to our YouTube channel. Thanks to those who have subscribed and supported our video series. In this episode, we will hear from Michelle Chrisp, a registered nurse and community-based certified diabetes educator in Winnipeg, Manitoba, with over 20 years of experience. She provides support to people with type 1, type 2, and diabetes in pregnancy at the Winnipeg Clinic. Michelle is also a certified pump trainer, as well as a research nurse with the University of Manitoba, where she is currently focusing on automated insulin delivery technology in pregnancy. Michelle will walk us through what time in range is and what it means, what the recommended goals for using time in range are, and why time in range is useful and who would benefit from using it. She'll also walk us through some strategies to work towards achieving the recommended goals for time in range. We recognize that the content in this video may not be relevant for everyone and will depend on what your experience with diabetes is and what devices are available to you where you live. If you have specific questions about diabetes management, please reach out to your healthcare team. These videos are for educational purposes only. The content discussed in this video is not intended to be medical advice, and to the extent that medical advice is required, you should consult with a qualified medical professional. The information discussed in this video cannot replace consultations with a qualified healthcare professional to meet your individual medical needs. The views and opinions expressed in this video are those of the speakers and do not necessarily reflect the views or positions of Diabetes Canada. As always, we hope that this video sparks your interest in learning more about diabetes management. And now over to our guest speaker, Michelle.
Hi, everyone, and welcome to another Diabetes Canada Deep Dives. Today's topic is time in range. My name is Michelle Chrisp, and I'm a diabetes nurse educator coming to you from snowy Winnipeg, Manitoba. So what we're going to discuss today is time in range. What is time in range? Recommended time in range goals, the usefulness of time in range and who might benefit the most from it, and steps to increasing time in range. Time in range is defined as the percentage of time a person spends with their blood glucose levels in a set range. It's commonly generated using 14 days of glucose data, and it's a practical metric for showing where your blood glucose levels sit through the day and from day to day. If you're using a continuous glucose monitor, that is probably the most accurate way to capture time in range. However, it can also be captured manually by using a blood glucose meter. In that situation, for about 2 weeks, you would test your blood glucose before and after meals, and occasionally through the night. And then you would take all those results and calculate how many of them, or add up how many of them are in your time of your target range, divided by how many of them you've done in total, and times by 100. This is a lot of work. And we know that when we test our blood glucose, we're capturing a single point in time. And we also know that our glucose can vary every 5 minutes, and it's impossible to test your blood glucose that frequently. Time in range can also be calculated by blood glucose meters that Bluetooth over to different apps. So the Contour app, or My Sugar, or One Touch Vario. These are Bluetooth apps that can actually automatically generate your time in range every time a glucose level is put into there. There are also TiPool and other types of software and apps that can automatically generate time in range. And again, by far though, the most accurate way to calculate time in range is by using a continuous glucose monitor, or a CGM. And these devices have their own software apps that will automatically generate that data. When we think about time in range, it's most commonly shown as a bar graph. And that bar graph you can see there is stratified into different color ranges, with the red being the time below range, The green area being the time you spend in your target range, and the yellows being time above range. Depending on the device you use, you may also see your time in range as a pie chart, like the one on the right. In 2019, a panel of experts got together and published recommendations about where time and range goals should be set. Not only the target ranges, but also the amount of time or percent of your day that you should be spending in those target ranges. So you can see on the left that for most individuals, healthy individuals with type 1 and type 2 diabetes, the goal is to have a target range of about 3.9 to 10 and to spend about 70% of your time there. No more than 4% of your data should be below range, and about 25% acceptable to be above range. For older high-risk type 1 and type 2 individuals, the time and range target goes down a little bit to 50%. We don't want these individuals having a lot of hypoglycemia. It's more dangerous. So less hypoglycemia, the better, less low blood glucose or time below range, 50% within that target range of 3.9 to 10, and acceptable to have 50% above. For pregnancy, we know that outcomes for baby are improved when we have a tighter time and range. And so for those individuals, the target range is between 3.5 to 7.8, and to spend about 70% of your time there. When we talk about time and range, it's good to talk about it, I find, in time itself. Sometimes the percentages are hard to grasp. And so putting it into that time frame of, well, 70% of your day is about 17 hours. So you want to be spending about 17 hours of your day between 3.9 to 10. 1% of every time and range percentage is 15 minutes. So that's where we get those numbers from. Less hypoglycemia, the better. And the less hyperglycemia, or the higher, over 13.9, the less of that, the better as well. Even though we have these recommendations, it's really important to remember that they need to be individualized. So not everyone may have time and range targets that fit these guidelines. You may have an individual who's at more risk for hypoglycemia, or a younger individual, or a more frail individual, or someone with really complex health needs, where their time and range targets need to be different, and that's okay. If you're starting off with higher blood glucose control and bringing your glucose control down, you may also want to expend your time and range so that you're gently starting to bring things down closer to target. So how is time and range different from A1C? You know, we go to the lab every 3 to 6 months to take a look at that A1C. And what is A1C? It is the amount of glucose that's stuck on to the red blood cells in our blood. It's a gold standard. It has been a gold standard for many years. And we have a lot of research to support that A1C can both prevent and predict complications. A1C doesn't match average glucose in a one-to-one kind of way. And so when you get your A1C, to turn it into an average glucose, you might look at a chart like we have on the right there, where, okay, an A1C of 7 is about an average glucose of 8.3. But we know that there are limitations of A1C. And this is a great pictorial from Diatribe that shows us the many faces of a 7% A1C. So you can see that the individual on the left has 100% time and range and an A1C of 7%. But they have very flat and narrow and in range blood glucose control from day to day. So they don't have a lot of peaks and valleys. And you can imagine that that individual probably feels less exhausted, or maybe emotionally or physically less exhausted from all the peaks and valleys that can happen when you live with diabetes, both type 1 and type 2. The person in the middle has also a 7% A1C, but they are 70% in range, with 25% of the results over their target range and 5% of the results below their target range. And you can see more peaks and valleys in that graph. And the person on the right also has a 7% A1C, but they're spending about 40% of their time in their target range, 40% above their target range, and 20% of their time low. And 20% of time with every percent is 15 minutes. That's a lot of hypoglycemia. So you can see how there are limitations in A1C in terms of showing us the day-to-day variability that is living with diabetes, the highs and the lows. And those highs and lows can be exhausting. So an A1C of 7 doesn't always reflect all of that. And that is why time in range can be so much more useful as a metric. We have research to support A1C and for preventing and the risk of complications. But now we're starting to see research for time in range as well. So there are emerging studies for neuropathy as well as eye damage, retinopathy, and kidney damage, microalbuminuria. In terms of your time in range, the more time you spend in range, the lower your risk for these types of complications. We also know in pregnancy that higher amounts of time in range also lead to better outcomes for baby. When we're looking at time in range reports, it can be really overwhelming. So I think one of the first things we can do is take a look at that bar graph and take a look at the percentages there. Every time we increase our time in range by 5%, that's another hour that we're spending in our target zone. And there's clinically meaningful significance with every 5% increase. Other metrics that we might want to look at, other than that bar graph, is something called the ambulatory glucose profile, which takes 24 hours of data over 2 weeks and puts it into a nice line. And then we can really see where on average our patterns might be. The software and apps will also sometimes highlight if they can find patterns of where your time above range is or where your time below range is. They'll also bring that out and highlight it for your attention, which is useful when you're staring at a sea of data. So another example of an ambulatory glucose profile, you can see that green line that kind of goes through, or that darker line, that's your mean or average glucose. And then the cloud around that, that's a little bit darker, is sort of your 25 to 75% of data. And then the larger cloud around that encompasses more like your 10 to 90% of all your data. When we're looking at an ambulatory glucose profile, we're looking at what that mean line does. Does it go up? Does it go down at a specific time of day? And how expansive is the data? In other words, how much variability does your glucose have from day to day? Daily reports is another nice way to look at data. And this too can be overwhelming. But if you're trying to tease out, are my weekends different from my weekdays? When I'm babysitting my grandchildren, do I have more hypoglycemia? These are really nice things to go in and take a look at. Okay, these are the things that happened those days, and this is what happened to my blood glucose. There are other really useful time and range metrics. So some of the things that those apps and software will generate is an estimated A1C, or what we call a glucose management indicator, which is that if you have 2 weeks of data and you extrapolate it over 3 months, your A1C may be estimated to be. We also have something called a coefficient of variation, which shows us the variability of your glucose from day to day. A larger coefficient of variation means that your risk for hypoglycemia is greater. You can also see then, so we talk about time in range, but we also talk about time below range. And the other important term to talk about is time above range. In 2019, I watched a really good talk by Adam Brown from Diatribe, and I loved his analogy about time in range as a highway. What keeps me on the road more? So if your time in range on the left side of the highway is that time below range, and on the right side of the highway is that time above range. And then staying on the highway, that's your target zone. So when you're looking at your data, reflecting on what keeps me on the road, what sorts of things that I do in my daily life that keeps me on the road. And how can I do more of those things? What drives me off the road in either direction, driving me low or driving me high? And how can I recover quickly when those things start to happen? And do I have guardrails to prevent extreme off roading? So, guardrails might look like more meal planning. Maybe when you go out to eat at restaurants, looking those menu items up to find the ones that are maybe a better load of carbohydrate for your blood glucose. Um, Snacking before you exercise to prevent hypoglycemia or low blood sugar, or taking a snack before bed when your glucose is at a certain level to make sure that your glucose stays steady through the night. Those are the types of guardrails that when you're staring at your data, you can start to formulate and have those conversations with your diabetes care providers. And so, this is why time and range can be so useful. It can help you recognize blood glucose patterns. It can also be a springboard for really meaningful conversations with your diabetes healthcare team. And unlike A1C that looks at data over 3 months, time and range can be generated on a daily, weekly, or every 14-day level. So you can really start to see quickly when you make changes to evaluate how those changes made a difference, either lifestyle changes or medication changes. So let's talk about how can I improve my time and range. I think one of the first things is to look at your data. We know that if we don't look at the data, it is meaningless. So, looking at your data and sharing it with your healthcare team. A lot of the CGM devices can actually load data up to the cloud. So, your diabetes care team, if you give them permission, can go in and remotely look at data for virtual visits and things like that, which is really useful and was very useful around COVID when a lot of people weren't comfortable coming into the office. The first thing when we look at data is always assessing for safety because hypoglycemia can be so problematic. It's really important for healthcare providers like myself and for individuals living with diabetes to focus on how much time below range are we spending. And then taking a look at how much time are we spending in our target range. And one of the best questions you can do with your healthcare provider is talk about where my time and range target should be. It doesn't always have to reflect what those international consensus guidelines recommend, certainly right away, or even depending on the complexity of your health. Then we want to look at areas to improve. So, how much time did I spend above range? And then discussing ways like those guardrails, ways to reduce that time above range. And coming up with an action plan that's simple and achievable and something that you can take a look at and evaluate if it was effective. So let's talk about improving time and range. We know the first thing is that wearing CGM or checking your blood glucose more often is a way to get more in tune with your numbers. Talking to your diabetes healthcare team about where your time and range target should be is really important. If you're going to sit down and look at time and range, I think that's a great question to start off with. Where should my time and range be? Observing the data first and then adding notes about what you did that day. That's really useful. Was it a day that I looked after the grandkids? Was it a day that I went out for supper? Was it a day that I forgot my lunch dose of insulin? Watching and learning about your trends, and sometimes those apps and software can identify those trends for you. But am I more consistently high after dinner? Am I more consistently low before lunch? Making one change at a time and seeing if that impacts your time and range for that time of day. Focusing on habits versus the percentages. We can get very number focused with diabetes. It is a numbers game so much. But focusing on when I did this, this was the outcome. I like that outcome. Maybe I'm going to do that more often. And talking about what's going well, we get really focused on what isn't going well. That's human nature. But talking about what's going well is so important, especially from a prevention of diabetes distress. So remember to do that. And oftentimes those apps will generate your best time and range day was, and you can reflect on that. Sometimes it's good to take that, print it, and put it on the wall. Remember that you're not your numbers. When we're testing blood sugars or when we're looking at our time and range, you're just a number. It's a fuel gauge, and it's telling you how much of the time do you have the fuel in the right amount, how much of the time is with too much fuel, and how much of your time is spent with too little fuel. High levels of emotional distress from trying to achieve that perfect time and range is also not healthy. So it's really important to be realistic and kind to yourself when you're looking at your time and range and celebrating small gains. Again, even 5% increases in time and range, that's another hour of your day that you're spending in your target range. Also, remember, diabetes can happen. This was taken by a good friend of mine who lives with type 1 diabetes, and she does a little bit of art on her CGM screens so that we can kind of like, yep, we can have our best intentions for the day or do the exact same thing we did yesterday, and our results can be very different. So sometimes just diabetes can happen. Adam Brown also talks about over 42 factors that affect our blood glucose. This is also very overwhelming, and many of these things we can do very little about. So it's important to focus on the things that we can change or that we do have control over. Some of the practical tips for improving time and range might be exercise, going for a walk. Even just 10 to 15 minutes can help lower that blood glucose and bring those levels back down. Getting more sleep. We know that too little sleep can increase insulin resistance and worsen our mood, and all of those things can affect our blood glucose. Staying hydrated is really important. Your diet, trying new foods, or looking at carbohydrate amounts and speaking with the dietitian, or choosing foods that trickle into the bloodstream versus gush. Those are foods that are lower on the glycemic index. All of those things can help, especially those after meal curves. Building strategies to reduce stress. So we know that stress often raises blood glucose. So how can we work things into our day that help us to manage stress better so there's less impact on our blood glucose? If you're taking rapid insulin, consider insulin timing. I work with a lot of people who are on multiple daily injections or on insulin pumps, and even not even changing the insulin dose, but just the timing of that rapid insulin before you eat can make a huge difference in that post-meal curve. Being patient with your blood glucose levels. A lot of times when people start to see data that they never saw before, they panic and they start to take too much action to bring that blood glucose down. If you're on insulin, that can result in a lot of time below range. So being patient, just watching that data first, and then starting to formulate a plan. Being aware of environmental factors that can affect your blood glucose levels. So not unusual to hear, summer heat, it increases or makes my insulin absorb faster. I'm more active. And these are the reasons why I'm having more time below range. So being aware of those kinds of things. Getting into a routine. It's really difficult to establish patterns with blood glucose, whether you're testing them or whether you're wearing a monitor, a continuous glucose monitor. It's difficult to find patterns if your day-to-day routines are radically different. So trying to develop some kind of routine helps us to better see the patterns, the things that are working, the things that we need to work on. And talking with your diabetes care team for continued strategies to improve your time and range. And remember that time and range is a moving target in terms of you're going to have good days, you're going to have good weeks, and you may have days that don't go so well, days that aren't as good. So time and range is going to be flexible. We're looking for overall trends towards increasing your time spent in target. Who would benefit most from looking at time and range? We know that people with type 1 diabetes, including those who are on multiple daily injections and those with type 2 who are on multiple daily injections, these people are at greater risk for both time above range as well as time below range. And we know that these individuals would benefit from looking at time and range more, and the data supports that. I think really any person with diabetes who wants to take a more detailed look at what impacts their blood glucose levels with the goal of improving their time in range would also benefit from that. But it does, uh, you know, um, rely on coverage in terms of your insurance coverage as well as your provincial coverage as to whether you can go on devices like CGM that would accurately capture time in range. And remember that time and range data is meaningless unless people with diabetes and their diabetes care team take the time to check it. According to the clinical practice guidelines with the new update in 2021, those people who would benefit from CGM are people with type 1 diabetes using multiple daily injections, people with diabetes who cannot feel their hypoglycemia or have had severe low blood glucose, adults with type 2 diabetes using multiple daily injections, and pregnant women with type 1 diabetes. Access to CGM varies across Canada widely. And so, if it's something you're interested in looking at, it's important to talk to your diabetes care team as well as your insurance if you have, and your provincial government to see what sorts of criteria and eligibility there are for you, depending on your age and the type of diabetes therapy you have and the type of diabetes you have. I hope that I've answered some of your questions about time and range today. And I thank you for having me to talk about this really important topic. Thank you so much. Bye bye.
Thank you so much for tuning into this very informative episode of Diabetes Deep Dives. And thank you to Michelle for a deeper look into time and range. Again, this topic may not be relevant to everyone living with diabetes, but we do hope that you found it interesting and learned something new. Please take the opportunity to keep the conversation going by posting a comment in the comment section on YouTube. You can provide us feedback about the video by clicking on the link in the feedback survey in the description box. If you have ideas for other topics you'd like to learn more about, you can include that in the comments or feedback survey as well. Michelle mentioned that access and financial coverage to medical devices for diabetes, such as continuous glucose monitors, varies by province. In the YouTube description box below the video, we have included a link to a Diabetes Canada document that outlines the coverage for CGMs by province as of March 2022. For more information about diabetes management, please visit our website at diabetes.ca. You can also email us at info@diabetes.ca or call our info line at 1-800-BANTING. That's 1-800-226-8464 and speak to one of our information and support specialists who can address your needs. Thanks again for joining us, and see you next time.